And now, depending on which of the 8 states and territories you're in, Kevin Rudd's health reform plan has received a very different welcome and response from those places.
Indeed it has. But the opposition has labelled it an election ploy and said the government was banking on the states rejecting the proposal. For more, Health Minister Nicola Roxon joins us now from Brisbane. And Minister, it's not a good look, is it, if the states, as has been reported, couldn't agree on a date for the COAG meeting to start with?
Well, look, I think it's to be expected that the states and territories would have different views about this issue. Let's face it, it is a very complex change. It's a fundamental change to the way that we fund health services, but it is needed. We cannot simply continue with business as usual, and the states probably want some time to absorb the detail. They will negotiate hard, as you would expect, between now and COAG, and I'm very confident that this is a good plan to make the health system sustainable into the future, to get more federal funding but also to get more local responsiveness. So being federally funded and locally run, a 60% fixed share from the Commonwealth is a big change and something that will make the health system more sustainable into the future and make sure we're not wasting a single scarce health dollar.
In fact, one of your strongest critics is the Victorian Labor government. It says the plan as it stands at the moment denies it extra money it needs right now, up to $1 billion. How will you be attempting to win over that government? Because from all accounts, the Victorian health system is one of the, if not the most efficient in the country.
Well, look, I think the Victorians are allowed to be proud of their system working pretty well. In fact, a number of the features of their system are in our national plan. But I think it's just a bit too cute for the Victorian government to pretend that it's all about money and that everything else is fine. We know that's not the case. And we also know that since we've negotiated our healthcare agreement when we first came to office, that Victoria's got $5 billion extra dollars into the system than what they had under Mr Howard. And of course that money is making a difference, and of course you would expect states and territories to ask for even more. But we want the foundations to be right. We want to be able to pay directly to local hospital networks. Victoria has some of that structure already in place, and I think when they sit down and look at this in more detail, they might well take a different view.
Speaking of money, how will the federal government come up with the $15 billion it will eventually have to kick into the health system?
Well, look, we have made no secret of the fact that state budgets into the future are simply not going to be able to accommodate the growing health costs of the nation. And of course, the community still wants and rightly expects us to provide those services. We think it makes more sense to move a share of that growing expense to the Commonwealth, where we have got more capacity to cover those costs. It will be a difficult debate, but ultimately people want good health services into the future. We have to be able to assure the public that every current dollar is not being wasted before we make additional investments. And we will have to have a debate about how some of those growing pressures will be funded into the future.
And the government isn't ruling out measures like raising taxes at some stage in the future to fund that shortfall?
No. Look, we're not ruling those sorts of things in and out. What we announced yesterday was a plan to make sure we can get the foundations right, the financing and the governance, so that we can be confident that every extra dollar that we invest is being well spent. Over the forward estimates, there's no impact in terms of the Commonwealth and state budgets, so that's the 4-year transition period. But there is a significant extra burden on Commonwealth expenditure over the 10-year period. That's one of the attractive parts of the package for the states, and of course we will need to make announcements to indicate how that will be funded into that forward period.
If I can just take you now through some of the issues raised by some of the interest groups. The Rural Doctors Association says that the health plan is absolutely silent from its point of view on fixing the critical shortage of rural doctors. What's your response to that?
Well, of course, when you are dealing with the foundation stone, when you're dealing with financing and governance, there are very many parts of the system that were not particularly dealt with yesterday. We've actually already taken a significant amount of change into the rural doctor area. From the 1st of July this year, new incentives kick in, where thousands of doctors will receive retention payments to keep them in rural areas, and hundreds of new communities will be eligible for funding, so that we've made it more attractive for GPs GPs to move outside the CBD and into areas where there are shortages. So this is not the plan that covers everything that the government's been doing for the last 2 years, or indeed everything that we will do in the future, but it is about getting the finances and governance right so we can be confident about how we invest in the system from here on in.
But if the bulk of this scheme doesn't start for 3 years, is it fair for distressed rural communities to assume that those doctor shortages may continue for as long?
No, well, the rural incentives kick in from the 1st of July this year. We believe that they will make a significant difference. Some of the changes in some communities, instead of people receiving, say, a $10,000 incentive, it's scaled up to about $70,000. It's a big difference from the past practices, and that's been warmly welcomed by doctors. We obviously, from the 1st of July, will see whether that starts to have an impact. And of course, the proposal for activity-based funding, where the Commonwealth pays a fixed share of every bit of activity in every public hospital, will have a loading for rural and regional services. We do know it's more expensive to provide those services in rural communities, and we've acknowledged that. The price will not be set for the CBD of Sydney and ignore the needs of Dubbo or Wagga or any other regional town.
Now, the Australian Greens, whose support you probably will need to get any relevant legislation through the Senate, given the opposition has vowed to block the measure, say the healthcare plan is silent on the very important issue of dental care, which, as you know, is critical to a lot of older Australians. How do you plan to address that?
Well, look, we could go through a very long list of dental care, of mental health, of aged care, of, subacute funding. There are a range of complex issues in the health system. Number one, that we've been investing in for the last 2 years, but also number two, that we've got new announcements and additional announcements to make. But the structural relationship with the states and territories has to be fixed first. And that's what we've announced yesterday, and obviously the detail of which we're discussing today and in the weeks to come in the lead up to COAG with the states and territories. On dental care, the best thing that the Greens and the Senate could do is actually allow us to fulfil our election commitments. They're blocking legislation in the Senate. We want to invest another $290 million into dental care, and that has been stopped, particularly by a Liberal Party that's opposed every initiative that we've taken in health.
Well, finally, Nicola Roxon, this is on any front a huge policy change you're attempting to impose in Australia. You're taking lessons from a certain other politician who's tried that but has run into diabolical problems, and that, of course, is the US President Barack Obama. What lessons have you drawn from the often treacherous path of healthcare reform from what we've seen happening or not happening more to the point in the States?
Well, look, I think the good news in Australia is we're starting from a much better base. We do have a very strong health system, but it is creaking under the pressure of a range of issues that are coming down the tracks at us. That's different to the US situation, but of course anybody in politics and anybody in health has followed what's been happening there. I'm confident that we will be able to negotiate a good outcome, and if we can't, we've made perfectly clear that we will let the public be the deciders of this. We will take this to a referendum if the states and territories don't agree to our plan. That's the commitment that the Prime Minister made at the last election, and it's the commitment we will keep.
Nicola Roxon in Brisbane, thanks for your time this morning.
Thank you.